Lung cancer is by far the leading cause of cancer deaths among Americans, more than breast, colon, and prostate cancers combined. But while the statistics are a reminder of the severity of the disease, advances in lung cancer treatments are helping change the outcome for providing much needed hope for all diagnosed patients. I got a chance to chat with the Assistant Professor of Oncology at Johns Hopkins, Dr. Vincent Lam, as well as a cancer survivor about the game-changing breakthrough for patients. Go ahead and shed some light on these advancements, Dr. Lam.
Absolutely. So, many people have seen their loved ones struggle with side effects of chemotherapy, or perhaps have even personally experienced it themselves. So these side effects can include hair loss, debilitating fatigue, low blood counts, which can be life-threatening. So we're really excited to have a new drug that can help reduce some of these side effects and thus make chemotherapy potentially safer and more tolerable for our patients.
How does this treatment exactly work?
So in general, chemotherapy works by killing the fast-growing cells in our body. So those are actually the cancer cells that we're actually trying to target. Unfortunately, there can be some collateral damage in that good cells are often impacted, such as your white blood cells that fight infection and red blood cells that help carry oxygen in our blood. So the new treatment is given before chemotherapy is started, and in a way temporarily puts the good cells to sleep so that they can be protected from the collateral damage.
Are there any other treatments in this research so far?
Absolutely. Lung cancer research is happening every day. I often tell my patients that we've made more progress in lung cancer in the past 5 to 7 years than the previous 30 years combined. So on the whole, our patients with lung cancer are living longer than we've ever seen, and that's because of research. So for example, one major advance is that we don't use a one-size-fits-all approach anymore in lung cancer. By personalizing the treatment for each patient's tumor, we're able to achieve better outcomes.
Montessa, you were a small cell lung cancer patient. Tell us your story.
Sure. At the age of 28 in 2006, after 2 misdiagnoses, finally an X-ray would reveal that I had the tumor the size of a cantaloupe that covered 3/4 of my lung in my chest. And that would go on to be a diagnosis of small cell lung cancer. I was a non-smoker, never would have thought it, wouldn't have been anywhere on my radar. I thought I had developed asthma late in life when I had shortness of breath and a cough that lingered on. And I would go on to have some of the chemotherapy treatments that Dr. Lam talked about, and with some of those negative side effects with the hair loss, extreme fatigue at 28, barely being able to walk around the corner of my apartment complex without my legs feeling like weights. It impacted my hearing. And this is just going to be a game changer for patients down the road.
Yeah, that was going to be my follow-up question there. What do you think about this new breakthrough?
I think it's awesome. Anytime we can minimize the side effects and improve quality of life while still treating the disease, I think that's what our patients are looking for. They're looking for hope, and they don't have to. When we look at TV, we often think about chemotherapy as horrible negative side effects that you're just going to be deathly ill, for most of the treatment. But this is a new opportunity, a new window for patients.
When you learned that you had lung cancer, were you surprised how little research had actually been done in the past?
Yes, after sitting here and then reading on Google Doctor after I got diagnosed and seeing that at that time the trajectory had not changed, especially for small cell lung cancer in general, for the past 30 years. The prognosis was still low, and even though it killed breast cancer, it still killed more people than breast, prostate, and colon combined. We have one of the least funded cancer, the disease, the least funded in research. So I turned my anger into advocacy and decided I was going to lend my voice to patients down the road and for lung cancer advocacy.
That is amazing. Good for you. So that I was going to ask why the funding is so vital, but you basically just explained it. It makes such a difference.
Yes, and I've had a unique opportunity to sit at the table here for the last 14 years. And in the last 5 years, we've seen extreme advances. You could turn on your TV now and see treatment for advertisements for lung cancer. Sometimes they'll say non-small cell lung cancer, but it's still research and it's working for lung cancer. So it's very important. There's work that has been done, but there's still work that needs to be done. So I urge anyone out there to find more information. And we would love to have you join our cause to fund more research by going to Lung Cancer Foundation of America, which is lcfamerica.org, or texting LCFA to 41444.